I thought I'd just start by introducing myself a little bit. As Kerry said, my background is in media and communication, so I'm not a subject matter expert in environmental sustainability, engineering, water quality, or any of those things. I was in communications at South Metro Health Service for a few years, and in WA Health Communications. Prior to that, I was a working journalist for the ABC for a few years and did a few other things in between. So that's my background, jack of all trades and a master of none. As we are in the media, you find out a little bit about a lot of things, and off you go. So it's the ability to absorb lots of information and distill it down to the most important part. So I kind of apply that to the work that I'm doing in sustainability. And I was explaining before how I came to this role. In South Metro Health Service, we're really proud of the fact that we've been ahead of the game in sustainability in WA Health. Well, we like to think so. And they formed this role in 2020, and we were the first health service provider in WA, public health service provider, to appoint a dedicated sustainability officer. So it's new role, new turf, new territory, not just for the role but for the organisation. And our interest in sustainability came about from a group of active medical staff, primarily out of our theatres. Our anaesthetists are very environmentally driven, and they pressured our CE to establish a sustainability committee and to appoint this role. So I was on the committee as the communications rep, because communications lie at the heart of all of this work. So when the role came up for other reasons, I put my hand up and thought, I'll give that a go. Little did I know. So I'm really proud of the work that I get to do, and some days I'm completely overwhelmed and just want to go and rock in a corner, and I think that what we're doing is like a drop in an enormous ocean, and what's the point? And other days I just go, this is so good and so exciting, and so I have more days like that than I do have the rocking in the corner. So the reason I've titled it "Why Climate Action is Good for Your Health" is because I think when I look out at this room, I think I'm looking at mostly people that deal with infrastructure, your engineers, your what I call pointy-headed people, which I rely upon for your expertise and your information and all that. We can't do the work we do without wonderful buildings and all the work that those sort of people do. But it's the human element in climate change and climate action that's so important, and this is where health comes in. That's me again. I thought I was going up, but it's going back the other way. This way. So climate change is the biggest global health threat of the 21st century. That was published in The Lancet as a headline, and this is why we need to act within health, because it's not just about the health of the planet and what we're doing to the planet, it's the impact it's actually going to have on human health and in turn on our health systems, and the demand that it's going to put on our health systems, all those wonderful buildings and everything else that most of you are involved in. Just in WA, these are the sort of impacts we can expect to see within WA as temperatures rise. So more bushfires, more frequent heat waves, more cyclone and weather activity, rising sea levels, all those things that you're familiar with climate change. But all of those things have an impact on human health, and as I said, impact on the health services. How do they do that? Well, they disrupt ecosystems, which lead to things like more allergies, more asthma, food and waterborne and insect-borne illnesses, especially like our vulnerable populations, like our First Nations populations that live up in the northwest and in the Kimberley. They're going to be impacted by especially the vector-borne diseases. There's displacement of people from their homes for extreme weather events, or they're just unlivable. We know that there's some island nations that are already struggling with that. So you've got displacement of people. You've also you can end up with malnutrition because we can't produce enough food out of the land that is viable. So it has this ability to cut across our entire society, and a lot of that also impacts on the health system, because the people that work in our health system are the people that are also impacted as well, and it means more patients at our doors. The first tenet of healthcare is to first do no harm. Any doctor will tell you the first thing they want to do is not do harm. So what am I about to do, and what will be the impact of that? So that's sort of our starting point. And in health, we are doing harm to our environment by the activities, the life-saving activities that we're carrying out. So we've got a responsibility to not be contributing to the increased burden of illness of our planet and of the people who inhabit it. Just to go back a little bit and give you a bit of background, we love our acronyms in government, and SMHS is the South Metropolitan Health Service. We've got 5 hospitals: Fiona Stanley, Fremantle, Rockingham, Murray District, and the Peel Health Campus. Peel Health Campus is run as a private enterprise at the moment. It's coming back into health next year at this stage. So what I'm talking about tonight doesn't actually involve Peel at the moment. When we take Peel back in next year, we'll be including them in what we're doing. We look after nearly a quarter of WA's population, so almost 700,000 people are in our catchment. And to give you a sense of the volume of people that we're dealing with, our EDs at Fiona Stanley and Rockingham see more than 200,000 people a year through their doors. Fiona Stanley is the second busiest emergency department in the country, second only to a hospital on the Gold Coast. So on any given day, we can have 350 presentations through the Fiona Stanley Hospital Emergency Department, so that's pretty big. 48,000 elective surgeries and 16,000 emergency surgeries, 180,000 outpatients, of which there are 850,000 actual appointments. So you've got those number of patients generating that number of appointments. Many thousands of babies delivered, and when we talk about people discharged, they're the people that have been inpatients and have gone out, but there's a whole lot of other activity. I think we're around 11,000 staff, but it changes on day to day, could be up, could be down. But that's approximately it. So it's a very big enterprise. We're one of the biggest HSPs, another acronym for you, health service provider in WA Health. So it's massive. So what have we done in South Metro Health Service? I've described appointing a sustainability officer, and we've been me at the moment. We've also got a number of committees within our organisation that support that work, the overarching South Metropolitan Health Service Sustainability Committee, and then we have site-based committees as well. Even though we're all part of the same health service, each of our hospitals has its own culture and personality and way of doing things. So we empower them locally to do their own things as well. We've added environmental sustainability as a strategic priority, which is really important. It sits alongside financial sustainability as a strategic priority. We endorsed an environmental sustainability framework in 2019 as a member of the Global Green and Healthy Hospitals, that's GGHH, and it's based on their 10 goals. And in partnership with Cundall, we have developed our environmental sustainability strategy for 23 to 26, and that was launched last week, and we're one of the first HSPs to launch it. Not the first one to make one, but the first one to launch. So it's really exciting that that's out there in the wild. It's a lot of it will be new to people and new concepts, and so the hard work begins now in terms of embedding that into our organisation. And we're just starting to look at ESGs for our board and what's important to them and what they want us to report on. So we're covering a lot of turf in a very small amount of time. So our environmental sustainability strategy, it's around climate adaptation and resilience, because that's how we're going to survive as a health service in terms of how we adapt to climate change and the specific challenges that offers for health. We have set a net zero target of 2040, which is ahead of the state government and federal government targets at this stage. So in all the work we did with our staff, they wanted us to be leaders, they wanted us to be bold and be right out in front and be ambitious. So that our 2040 net zero target reflects that. we're focusing on the areas at the bottom. You can see waste, travel and transport, energy, clinical care, supply chain and food. All of those are huge areas of consumption within our health service. The important elements obviously are governance reporting. We're still working those bits out as to what we report, and we do NGER reporting every year and some other reporting, but it's really how we then report through on these other elements. And leadership's a really important part of it. We're still getting a lot of our executive and leaders on board. We've got our chief executive definitely committed and energised, and members of our board, and we've certainly got our grassroots staff on board. It's the management in between that we need to educate and bring along for the ride as well. So as part of this exercise, we did the SMHS carbon footprint. So we, as a member of GGHH, we've got access to climate impact tools. So that was a really huge challenge for us and a real eye-opener, because although we have fantastic data in some areas, we have massive holes in others. And the holes are where health is kind of unique in around, you know, our patient travel. Like, we have many thousands of people coming to and from our campuses every day. How do we measure that? How do we know how many people are coming and going, and where they're coming from, what kind of car are they driving, etc. We know around our outpatients, we can measure that because we know their postcode that they're coming from, but we don't know what kind of car they're driving. Our staff at Fiona Stanley, we know how many people are coming and going every day because they have to swipe in and out. Again, we don't know what kind of car they're driving or how far they're coming from. So we've had to make a lot of assumptions around some of the areas that we're measuring. Some of our other campuses, like Rockingham, doesn't even have paid parking, so the staff just turn up and there's no way of knowing how many are actually coming and going. So the other thing is things like pharmaceuticals. I don't know if you know, but asthma inhalers are a major source of greenhouse gas emissions, and we need to be doing something in the pharmaceutical space about changing up to dry powder inhalers that aren't propelled by greenhouse gases. And they actually have their own category within our carbon footprint, so it's big, along with medical and anaesthetic gases as well. So while there's some elements that are common to probably all organisations, that health has its specific, very much its specific challenges and areas that we've got to work on. So this, while I have confidence in stuff that we can measure, like electricity and water and those things, and where we've got invoices for things like medical gases, there's still some areas that, like around our supply chain, this does not reflect really anything in our supply chain other than the things that are listed there. We use literally tens of thousands of items every day of the week, and we don't really have a handle on the environmental impact of those things. Single-use plastics are ubiquitous within health. I'll get onto that in a little bit in a way. So this is a start for us, and we're the only HSP that's done it. It was a big amount of work, and it just shows it's been a really big learning curve in terms of our, I'd like to say, our lack of data, but where the black holes are in terms of our data. So for us, because we're massive consumers of energy and water and consumables, you know, we've got a lot of work to do, especially around energy. There's not one of our sites at the moment that has any renewable power. Even though Fiona Stanley is the newest hospital in our fleet, it was open in 2014 or 14, but completed in 2013. So it's already 10 years old, and it wasn't, even though it is a highly efficient building, we don't have renewable power. Some of our older campuses are quite reliant on gas, so we need to be looking at ways of reducing our reliance on gas. We need to be looking at renewables and improved energy efficiency. Waste. It's enormous in health. So and waste reduction. We do recycling, but what we're interested in is waste reduction. We can't keep bringing the volume of materials through the front door and hope that our recycling and waste streams at the end of it will deal with it. and that waste has to come from a partnership with our suppliers and what they're supplying us with and what we do with it at the end of life. How it arrives, we don't want it arriving in reams of polystyrene wrapped in 4 layers of plastic wrap and, you know, in boxes full of bubble wrap, that kind of thing. I mentioned medical gases and inhalers, and our employee and patient travel at Fiona Stanley Hospital there's around, do I want to delete this document? No. Let's keep that. Just for let's delete the next, what did I didn't touch anything.
Click back onto the click back behind you.
Sorry, I'm not.
No, that's right.
I didn't touch anything, honest.
Don't believe you. Technology.
It's,
you can't live with it.
You can't live.
Shoot.
There we go.
Is that where you were?
Yeah, thank you.
Yeah, great.
So Fiona Stanley Hospital alone is about 2,500 staff on site on any given day. A lot of them are shift workers, so we allow people who work shifts to get a parking pass. But there's a whole lot of people that just come and pay for parking. They're willing to pay the 21 bucks a day. Our car parks are generally full by 9 o'clock in the morning, once you add all the patients and visitors that are coming as well. So we've got a parking crisis on most of our sites, not just Fiona Stanley. It's a massive issue. So we need to have a cultural shift around travel and people's expectations of how they get to work and how they get to our sites to access healthcare. So on that, one of the things we are doing is building our digital outpatients capacity. So it used to be pre-COVID, you would come along to the hospital and sit in a waiting room for 10 minutes, 2 hours, 3 hours, however long it might be, to have a 5-minute appointment with your consultant, who then says, yep, you're good for surgery, or no, you're good, we can, you know, you're healed, you're fixed, you can go now. So when you've got, you've got 840,000 outpatient appointments every year. That's a lot of travel to and from. So it's amazing that as much as COVID generated other issues for us in health, it offered this, which is the digital world in a couple of different ways. So it's revolutionised our outpatients. People can literally have their outpatient appointment with their doctor sitting in their car at lunchtime if they want, on their phone. They can be in Roebourne talking to our burn specialists. They can be anywhere. We've always had a robust telehealth network through WA Country Health. That's always been a robust network. We've now brought that into the metro area, and patients can choose where it's reasonable to have a digital appointment. So there were 283,000 of these last year, and you can see there the kinds of savings in fuel, hours of travel, and tonnes of CO2, which is the important thing from my perspective. But it's also about our patients and delivering them better care. And if you can have your outpatient appointment in your lounge room rather than coming all the way into a hospital, why wouldn't you do it? And in some disciplines, having people in their own home when you're talking to them has its benefits. So if you've got a paediatric dietitian trying to work with a family whose child isn't eating, and they've got the child at the kitchen table, and the dietitian can watch that child eating and seeing what they're doing, it's a much richer experience than dragging a screaming child into Fiona Stanley or Rockingham outpatients. So our biggest challenge is getting our clinicians on board. Our doctors are fantastic, and like I said, they first do no harm. And yes, seeing a patient face to face gives them comfort, but they're also seeing the benefits of this technology. Just another quick anecdote: our immunology clinic used to have like a 3-year waiting list. Through establishing a digital outpatients where patients are seen in the GP room with one of our immunologists on telehealth, we have reduced the immunology waitlist to 0. So this is children and adults from all across the state are now having their allergies and other issues dealt with virtually in real time, which has been amazing. So you can imagine how that improves people's health and their anxiety levels and all of that. So that's been a massive step forward. We've also got a virtual fracture clinic, can you believe it? So if you fracture your arm and the doctor sets it, then you don't need to keep coming back in. You go and have your x-ray, then your appointment is via telehealth generally with the advanced scope physiotherapist. We've got a virtual emergency medicine clinic as well. So we're sending, rather than an ambulance going out and bringing everybody back to the ED. They will do a telehealth appointment with the ambulance crew and the patient and decide whether the ED is the best place for them or whether they can go somewhere else. A lot of our cohort might be from nursing homes and elderly people. They don't need to come through the ED. That's the worst place for a lot of these people. So they might be sent straight to our acute medical unit directly as inpatients, or they might be sent down to Fremantle Hospital directly. So bypassing the ED altogether. That service has already seen around 10,000 patients in the last 2 years. And that's something that we can adopt statewide across all of our emergency departments. And let's stop dragging people through the doors of the ED, which is not where everybody needs to be. We're looking at our staff as well. So I'm one of these staff and of course we have to have an acronym, which is SMART, Structured, Mobile and Remote Telecommuting. So it means working from home or working remotely. So again, this is what COVID delivered us. When COVID first came, it was all hands on deck, and our chief executive didn't want anybody working from home because as corporate staff, we were being called on to push trolleys and help out and deliver blood and pathology, all sorts of things, because we had so many staff furloughed. So we needed all hands on deck. But once COVID started to recede and we got things more under control, we saw the benefit of having people working remotely. Now I'm probably talking to a room full of people that work remotely every day of the week, but it was a bit of a revelation in health. There's also this sense that we're all equal. If the nurse on the ward can't work from home, you know, is that fair that I can? Well, I think it makes sense, but we can provide the same sort of support to that nurse on that ward, whether we're actually sitting at our desks in the hospital or somewhere else. So when we did a trial, which we love to do in health as well. The trial showed there was about 4,000 kilometres of staff travel every week, 1,000 CO2e. Car parks, we freed up car park spaces and people not actually travelling on public transport, even though that's what you want them to do. We're also not doing that. In our department alone, we reduced our printing by a third, so it was like something like 30,000 sheets of paper that weren't printed over a year. It doesn't sound like much, but it's huge. So yeah, it's been a really great thing within health. So corporate staff, some clinical staff, where it's possible, we are smart working, which is exciting. Waste. So we serve more than 1.2 million patient meals every year, and plate waste can be as high as 50%, which is horrendous. And it's like that for a number of reasons. It's not a perfect system. Today I ordered the beef stroganoff and the rice pudding for my meal tomorrow. And then tomorrow I feel terrible and I don't want any food, but my meal's been ordered and it will come anyway. Or I've been discharged because I'm so well, my meal will come anyway, sometimes, not all the time. Or they come to deliver my meal and I've been taken off for a test or an x-ray or I'm in surgery. So it's not a perfect system, and we are working on a number of things to reduce that plate waste. But in the meantime, we've introduced food organics in our hospital kitchens. This wasn't possible before because our waste provider needed it to be purely food waste. No plastics, no paper, no nothing. It had to be purely food waste, which is impossible on a conveyor belt system where you're serving thousands of meals a day. They couldn't do that. So now we've got a contaminated waste food organics stream, which means like a half-eaten yogurt and a half carton of milk can go into the organic stream, and it goes off to our partners at Veolia, and they spin it through a big centrifuge and separate it all out. The organics goes out one side, the other materials go out the other, and are recycled where possible or binned. So that's had a huge impact on our waste, as you can see there. So just at our two hospitals, 346 tonnes last year, and at Fiona Stanley, 17 tonnes in the first 3 months. And unfortunately, at Fiona Stanley, we've got the highest food waste because we've got the largest number of patients. Our staff, our catering staff, have been absolutely brilliant. They've had to adopt entirely new practices, and they've embraced it because they know that they're doing the right thing by the planet. We've got a number of projects underway to reduce plate waste. One is very simple. Down at Fremantle, we've got patient care assistants that sit with people to help them order their meals. So they're ordering what they want. knowing that they're going to be there tomorrow or not there tomorrow, it's made a huge difference. We've already reduced waste there by 15%. And at Fiona Stanley, we're looking at a room service model, which is already operating at some privates and in the East Coast. It means that you literally, like you're in a hotel, you ring up, you put your order in and say, I'd like the beef stroganoff now, thanks. It's 10 o'clock at night, doesn't matter. Yeah. Chicken or the beef. Chicken or the beef, sir. So we also cater for, I don't know how many different diets, as you can imagine. We have soft foods, pureed foods, we have vegan, we have vegetarian, we have an offering for Indigenous people that's a kangaroo. We have people in our state rehabilitation service that are in hospital for many, many months at a time. So we have a specific My Choice menu for them. So they're not seeing that repeated menu every week, week in, week out. Can you think of anything worse than knowing what's for dinner for the next 3 Tuesdays? So yeah, so our dietetics team in catering are working really hard to reduce that waste. We want to get it down to as low as 10%, which is where it should be. It's really challenging. Plastic. I don't know how much people in the room know about plastic, but it is a scourge. It is the best thing that's ever been invented, but it's also a scourge. So, 1950 something, I think that is, only about 10% of all the plastics that have ever been produced have been recycled. So recycling is not the answer. In health terms, there's been some amazing research done by the Minderoo Foundation and some great teams there that have done literature research around plastics in human health. So they're starting to find that plastics have a role in a whole range of health problems and health issues. So we need to really be thinking about what we're doing in health around our use of plastic. So it's estimated we ingest about 5 grams or a bottle cap of plastics every week as human beings through our food chain, because all the plastics we send to landfill break down into microplastics and they come back. So this is a huge challenge for us. The other thing that drives our single-use plastics is infection prevention. So of course, first do no harm. So what's the best way to reduce your risk is to use something fresh, clean, untouched out of the packet. And it's cheap. Single-use plastics are cheap, cheaper than putting them back through sterilisation, repackaging them and sending them back in a lot of cases. Our hospitals now are not even really set up to do that. A lot of places in the NHS are actually going back to the future and going back to reusables, but a lot of our hospitals aren't set up for that. Our central sterilising departments aren't big enough anymore because they only do surgical instruments. They're not doing everything else from the ward. So there's really big challenges there in us driving down our single-use plastics. It's also about us working with our providers, the people that we're buying things from, to say, right, we don't want this as disposable anymore, we want it reusable. If you saw some of the medical equipment that was single use, you'd be amazed. It'd be like throwing that camera in the bin. But it has been reasonably successful in driving down infections, but not on par with the waste and the problems that it creates. Sorry, that slide's just a little bit off centre. If you think plastic production is set to double in the next 20 years and triple by 2060, it's not just our industry, it's every industry that's got to start looking at this. If I'm going over time and talking too much, someone wave at me and I'll wind it up. So on the single-use plastics, you might be aware of the WA plan for plastics. That's aimed at more takeaway outlets and catering and all of that. But in our hospitals, we use a lot of these items. So especially straws. You imagine we do lots of bendy straws and plastic cups for our patients. So we've swapped out a lot of those items. There's something like 850,000 fewer plastic items going to landfill now, just with straws. Pill cups, we've gone from plastic pill cups back to paper ones. Denture cups. You know, who knew that you needed denture cups? And lids, they've all been swapped for sustainable items. And in our kitchens, they've all swapped out all of their plastic, and our kiosks and our catering as well. So that's been huge. And a lot of work we've got specific, they're called product liaison officers, and they do a lot of work sourcing the goods that we need and product testing them. We can't just introduce something in a hospital without trialling it first with our staff and our patients to make sure it's acceptable. Because it's still got to be fit for purpose and still got to be part of the care that people are delivering. So that's our proud state rehabilitation team with the sustainable straws. So one of the areas that we've been looking at is this campaign called Think Before You Bluey. If you've ever been in a doctor's surgery or office, the plastic sheet with the slightly absorbent pad on top. In our health service alone, we use 440,000 of these every year, and they go into landfill. Well, I sort of decided that seemed absurd to me when I heard that number. When I first started in this job, I thought we've got to do something about that. And the Think Before You Bluey campaign was more than just this item. It was about getting people to think about waste reduction and what we're using every day and why we're doing it. So things, you can see the massive trolley of blueies there. So you see a pack of blueies like that. A new patient comes in, often onto state rehab, which is one of our highest users of blueies. So the State Rehabilitation Service looks after everyone that's had a spinal injury, an acquired brain injury, stroke, a whole range of issues where you might need long-term physical and neurological rehabilitation. So they have some high need, high care patients. So their practice was to take, when a new patient came in, they would, out of convenience, go and take a pack of 20 blueies in. Now that person might be there for 3 days and they use 4 of them. The other 16 have to go in the bin because they've been in a patient room. So by changing practice, by pointing out the wastage, by pointing out the environmental cost and the wastage from blueies, it's really raised awareness across our health service around all of the things that we use. But blueies has had a big cut through. So in the first 9 months, we're down 17,000 and that's 73,000 fewer ordered. I mean, the waste itself isn't an enormous gain, neither the money. In health terms, that's nothing. But it's really been empowering for the staff on the wards. We started with a staff survey. How do you use them? Why do you use them? What ideas do you have for things you could use instead? So staff are doing things like, instead of putting a bluey down to put an IV in, they put a piece of paper towel down, or they don't put a bluey down at all and they just wipe the surface, which they have to do anyway. Bringing babies in to weigh in the clinic, instead of putting a bluey down in the baby scale, they put the baby's blanket down and weigh the baby, and then they wipe the scale anyway. So just little things like that in our outpatient clinics and on our wards has made a really big impact. The key to these things though is keeping them rolling and maintaining that behaviour change, because it's very easy for people to slide back into where they were. So our next campaign is gloves. The numbers on gloves are terrifying. So in our health service, non-sterile gloves, forget the surgical gloves, 16 million gloves a year for our 5 hospitals and ancillary services. That includes our catering people use them, and our cleaners and our porters, but our nurses and our doctors are all using them for no good reason a lot of the time. $2.7 million a year we spend just on gloves, those sort of gloves. And I worked out that's about 77 tonnes of waste when they all go to landfill, which weighs the same as 12 African elephants. For someone who doesn't do maths, that was a very, very big achievement for me to work that out. So we know from other parts of the world where they've done gloves off campaigns that at least sometimes up to 50 to 60% of gloves are used unnecessarily. People think they're protecting themselves, but they actually are worse for spreading germs and for hospital-acquired infections because hand hygiene, washing your hands and keeping clean hands, is the best protection you can have. So we really only want people to wear them in certain circumstances when they're coming into contact with bodily fluids, preparing some drugs, some IV drugs, obviously your chemotherapy drugs and things like that. People have got to protect their hands from chemicals. But yeah, we want to reduce glove use by about 25%, and we think we can get there pretty easily just through this campaign based on the cut through we were able to have with the Bluey campaign. And as I said, they have the added bonus of raising awareness about just general usage of things and stuff. I spoke about anaesthesia because it's obviously unique to health, and our anaesthetists are the driving force in sustainability in our hospitals in their own area. The theatres are responsible for anywhere between 20 and 30% of hospital waste. Just the volume of stuff that they use in theatre and the disposable, everything comes wrapped in plastic, everything comes wrapped in sterile wrap. It's massive. Syringes, PVC. We do a lot of recycling and waste segregation in our theatres, which is challenging. That's again education and behaviour change, getting busy doctors and nurses to be separating out their waste, but they've all embraced it and they're doing an incredible job. So you can see, one anaesthetist can, just by doing you know, surgery is 1,000 kilometres a day by the choice of anaesthetic gas that they use. So there's, up the top there's desflurane, sevoflurane and propofol are the commonly used anaesthetic gases. Desflurane has a really high greenhouse gas profile. So back in 2020, our anaesthesia department took a vote amongst, there's 200 in the anaesthetics department in Fiona Stanley Fremantle Hospitals Group, and they all voted to discontinue the use of desflurane, to use up the remaining stock and then no longer order anymore and move to more low carbon anaesthesia. And you can see the impact that's had on our CO2 emissions from theatres in that time. And we now, across Mars, do not order any desflurane. Rockingham and Fremantle theatres don't use it anymore either, and it's actually going to be taken off our impressed in our pharmacy at the end of this year. So you, even if you want to use it, you won't be able to. For anaesthetists, again, it was a behaviour change that, and to give them confidence in the other methods of anaesthesia that were just as safe for our patients. We've had no adverse impacts from using low carbon anaesthesia. So that's been a huge gain, and our anaesthetists have been the driving force in that. Their next target is nitrous, so happy gas, laughing gas. You use it at the dentist, widely used in childbirth, and it's important for pain relief. But nitrous is also the happy gas. It's just everywhere. Everyone spreads it around. Like there's lots of buildings have leakages of their systems. It might be like in some areas just the tap's on and it's running, because it dissipates in the air pretty quickly, but it does have a high greenhouse gas profile. So that's the next one that they're going to be looking at, but that requires an audit of your system. So you actually have to shut your nitrous, piped nitrous down for a period of time to measure your leaks. So you have to then be using bottled nitrous. So it's they've done it at Fremantle, and they've discovered that Fremantle, even though it's a much older facility, doesn't have any leaks, any significant leaks. Fiona Stanley, they're still to do that, and obviously Rockingham. So yeah, this is where we're going to make big gains in our carbon emissions, is by these sort of initiatives. The key to our success is staff engagement and giving people ownership of what they're doing. They can't help us with the electricity grid. They can't change where we get our power from. A lot of the time they can't really change where we're getting our products from. But what they can do is at a local level look at what they do in their local clinic or on their ward and decide to do things differently. So we've formed the Green Ambassadors Network, so staff can sign on to that. There's no qualifications for it, you just have to be interested. So we've got about 250 staff signed on, proudly wearing their fully recyclable badge. So that's been fantastic. It's a great network to spread information, and I organise symposiums with guest speakers and do every month they get a reading list of interesting articles and invitations to events. But these are the local champions driving initiatives. Each department has its own nuances. So one of our green champions is in the urology department. So every month, or every week, the urology department and all departments have what they call an MDT, a multidisciplinary team meeting. Everybody comes together, physios, surgeons, comes together and talks about their patients and what they're going to do over the coming week. And they were printing, are we going to lose power? Yep. They were printing up to 40 pages per person in a room of 30 people in a meeting. So all of you having 40 to 50 pages of paper. So now it's a BYOD, bring your own device, and everybody runs the paperwork off their laptop with only a couple of people with printed copies to note down. Then the amended documentation is sent out straight after the meeting, so everyone's got the most up-to-date documentation. So that's one department, one meeting, and they've I think they've saved something like 50,000 sheets of paper in the past year. So it's been, it sounds small, but for that team it's really important.
It's not small if you've got to carry that many boxes of paper in.
Well, put it in it's got to go to the bin. And we, as everybody does, our waste is all disposed of by weight. We pay for that. So that's the other thing that's happening around the place through the Green Ambassadors Network is there's green groups springing up in all our different disciplines. There's one in ICU, cardiology, ED, urology, renal, the acute medical unit, all of these areas are looking at their own operations and what they're doing and how they can do it better and what kind of impact they can make. So in our dialysis unit, they use what's called reverse osmosis water, so it's as pure as possible. But there's water left over from that, and we need to work out a way of getting that into our gardens or reusing it in some way. Plus, there's a lot of leftover water, so there's grey water out of that. So we can make some big gains there. But some things like that are big ticket items and big projects, and other things are a lot smaller down the middle. But the Green Ambassadors Network has been really pivotal in making really grassroots change. And I think I spoke about before, we've got the high level strategy and the board engaged and the chief executive, and we've got our staff that are really motivated and really engaged, and we just need to kind of spread that right through the organisation now. That's the next challenge. Educational engagement is really important. Last week, along with the strategy, also launched this. We have a online learning management system, everything from hand hygiene to how to put in a catheter to whatever. And so last year we developed this environmental sustainability module. And it's really for all staff, and it's about the why we need to do it. So some of the climate health stuff that I kind of touched on a bit earlier, what's being done, what the federal government, state government, and what we're doing as a health service. And also it has some really practical ideas for people, how they can get things up and going in their own area. They've just got a couple of those checklists up there, so you can do a checklist of your clinical space, and it gives you a score at the end of how you're doing, and then invites you to set some target areas for you to work on with your green group. We've done the same thing for office, so it's clinical and administrative. So yeah, it's only just been launched, so we'll wait and see how that goes. Our consumers can also be part of the solution, so we're trying to educate our patients around, there's a concept called Choosing Wisely. It's a national program that's about understanding the treatment you're about to get, or the procedure you're about to have, or the test, and asking your doctor, do I need that? What are the implications if I don't have that? A lot of patients, doctors err on the side of caution, and they order additional blood tests or scans that may not necessarily be necessary and may not make any difference in the outcome, and it might be to make the patient feel better. So the doctor, through Choosing Wisely, can have that conversation with the patient as well. So if we understand and use Choosing Wisely well, we can eliminate a lot of unnecessary care. Around 30% of the care we deliver can be unnecessary, and over-testing, over-treating, overdoing things. We're asking our patients and driving them to ask for digital outpatients, not leave it up to the clinician, but to actually make that request. Can I have my next appointment over the phone, on my phone via video? This is our big challenge, is public transport or active travel. This is really our next big ticket item that I need to create a project around for our staff and our general public. The parking situation at the hospital is at breaking point. On any given day, there's people parked on footpaths and they're getting fined by the council on the council land. There's queues out our car park. It can't go on. We're going to build a new women's and children's hospital on our site as well. So that's just going to be an added challenge. So we have to change. It has to be a cultural change where the expectation is not that you drive your car to work or that you drive your car to our hospital for your appointment. But we need to work with the Public Transport Authority to make sure that the bus and train timetables align with our staff shifts and our busiest outpatient appointment times. So we need to provide end-of-trip facilities that are adequate for staff. We need to provide chargers for electric vehicles and e-scooters that are fireproof. And we just ask people to keep healthy. So if you can keep healthy and stay out of hospital and stay out of our health services, that's the other side of it too. So with an ageing population, yeah, we're getting more acute illness and people being sicker for longer. So stay well, people. That's it from me. There's a bit more information, and you can see our entire strategy on our South Metropolitan Health Service website. And I recently did, if you haven't heard enough from me tonight, and I know that you probably want more, I recently did a podcast as part of our Health Stories podcast. So, you know, if you want another 25 minutes, then it's freely available on wherever you get your podcasts. So thank you. Thank you for having me.